So today I'm going to be talking about the changing face of dentistry in the US, how a more diverse workforce is reshaping dental practice. If you have any questions, feel free to chime in for any of you who are watching live. So I'll be talking a little bit about the demographics of dentists in the US and the US population as a whole, and what that means for the practice of dentistry. Just so you know, this presentation is largely based on data from the American Dental Association's Health Policy Institute, which is a really great resource if you ever want to know about US dentist data. They do
Theresa,
so many surveys.
Sorry for interrupting you. I think we lost your presentation. If we can.
Well, good news. I hadn't really done much in it yet, so I'll just reshare that.
Thank you.
Not a problem.
There you go.
All right.
Excellent.
Can you see it again?
Yes, thank you.
All right, perfect. So yeah, it's based largely on data from the American Dental Association's Health Policy Institute. So definitely recommend checking them out if this is a topic that interests you. And as I got such a great introduction, I am the editor-in-chief of Dr. Bicuspid. You should definitely follow us. We do breaking news, case studies, videos, webinars, events, etc. The podcast I produce is not associated with Dr. Bicuspid, but it is called Mission Driven Business, which is a kind of like social entrepreneurship podcast where we talk with a lot of entrepreneurs. Many of them are in the finance world. And I think that one's a lot of fun too, in case you are interested in mission-driven business or finance or entrepreneurship. So for this presentation, I'm going to be talking about first the shifting demographics of US dentists. So how it's changing in terms of gender, race, ethnicity, and age, and then how those demographic changes tie into shifts in how dentistry is being practiced here. And so that's practice ownership, group practice, corporate dentistry, and then my kind of spin on it is I think it'll change also how we're going to care for the underserved population. So before we can kind of understand where we're going and where we are now, I feel like we kind of have to take a step back and know the historic demographics of dentistry in the US. So if you want to step with me into my time machine and put on some bell bottoms and mini skirts, because we're gonna hop on back in time to 1960s America. And you know, it's magic era. There's like The Twist is apparently like one of the most popular songs when I Googled this. And this is like before we went to the moon and before women could open credit cards in their own name here in America. So this is like the dark ages. And in that era, I'd like to introduce you to the average dentist of 1960. And I've decided to call him Robert. I don't know if Robert was the most common dentist name in 1960, but I looked up the most popular male names from the past 100 years, and Robert was number 2. So I think there's a good chance that there was a Dr. Robert in 1960 America. And much like my friend Robert here on this slide, dentistry in the US was pretty much 100% male. And from Columbia, it sounded like it was 90% white. And so I can imagine that Robert couldn't even fathom the shift that was coming to dentistry in America in the next 50 years. And I don't think, like, if he stepped with me back in this time machine, he could expect that by 2019, if we saw the average dentist, it would be, oh, it's Robert again. But yeah, so in 2019, even today, the average dentist in the US is a 49-year-old white male solo practitioner. And dentistry has come a long way. It has changed significantly since the 1960s. But I think what gets missed in the average dentist, like the picture of what would be the average dentist, 49-year-old white male solo practitioner, is that in 1960, what was average was pretty typical of the profession. But what is average today is a lot less typical of dentistry overall because the practice and the practitioners are a lot more diverse than it used to be. So we're going to talk about some of those changing demographics. And the first really big one is gender. And I would say this is probably the area where dentistry has shifted the most since 1960. So you may be surprised to hear this, but women account for roughly half of the global population. I know sometimes I'm surprised too. I've walked into a few rooms at dental shows with like almost all men, but yes, there's actually women are 51% of the US population. So that is a fun fact. But kidding aside, when you look at the percentage of female dentists, we have come a long way in dentistry. In 2010, female dentists represented, women represented 24% of dentists in the US. By 2020, the population of female dentists was 35%. And so that's 1 in 3 dentists in the US are women, compared to, again, when data I saw from Columbia said in 1960 it was almost 100% men. So that is a huge change in a relatively short amount of time. And it's interesting because it doesn't look like that is going to slow down anytime soon. And so the reason for that is because of the number of female dental students, and it just keeps going up. So US dental schools reached gender parity for the first time in 2018. And that was a really big deal. That meant out of the incoming dental students, 50% were men and 50% were women, looking like the population of the US. But that split has gone even more female in the past few years. So if you look in 2020, 54% of first-year dental students were female. And I think we're gonna have to wait and see whether that trend is going to keep continuing and dentistry is going to get increasingly more female here in the US, or if it's going to even out and be roughly 50-50 going forward. I think it may stay a little bit more female, if I had to guess, simply because, at least here in the US, more women are going to college, and therefore more women are going into post-college or careers where you need a college degree, including dentistry. So I think it may stay slightly more female. Another shift that is happening across the US is that the US is getting more racially and ethnically diverse, and that is reflective in dentists as well. And so if you look at the demographics of the US as a whole, when I was looking, they're a little bit different than what's used in New Zealand. So I just want to take like a pause and kind of talk about how we do demographics in the US. It's not perfect by any means, but it's designed, I think, to give like high level trends. And so if you look at US demographics by race, this is from our federal government for 2021, white is by far the most common race. Typically that means that your ancestors at some point came from Europe. Many people identify from the country that their family came from. So like I'm half Irish, and we talk about the Ireland family farm, and my family goes really hard on St. Patrick's Day, even though I don't think we know anyone in Ireland anymore. So things like that. There's also Black or African American. Those terms tend to be used interchangeably. I think in recent years, it's been trending towards Black, and it includes reference to those within Africa, and then also within the African diaspora. Then Asian, again, similar to white coming from European countries. Asian is your family of origin came from Asian countries, Vietnam, China, India, etc. And then other 4%, that includes the 1% population here of American Indian or Alaskan Native, our indigenous population, and the people who were here first before anyone else. And then the also growing population, which in 2021 was 3% of people who are 2 or more of these races. So if that wasn't confusing enough, we also add another layer, which is ethnicity, and race and ethnicity are also often combined. And that means, for the all intents and purposes, whether you're Hispanic or Latino. Hispanic and Latino are broad terms that generally reference people from Spanish-speaking countries, often Mexico or Central and South America, but like not every country in South America speaks Spanish and the speak Portuguese, etc. But it's the same region. Many people who identify as Hispanic or Latino also identify as white. So for me, myself, I'm half Irish and also half Cuban. So I am Hispanic, Latina, but I'm also white. So I'm both, which is why it's confusing. And so moving forward, when I say white, I'm generally referring to non-Hispanic white people, just based on the data. And again, it gets confusing because like we often combine race and ethnicity when we're talking about data here in the US. All right, segue aside, back to dentists. So the percent of white, and again, non-Hispanic white dentists has been declining over time, similar to how the population of non-Hispanic white Americans have been declining over time as a percentage of the whole population. And so back when Robert was a dentist in 1960, Columbia said 90% of dentists were white. They didn't specify whether that was Hispanic or not, so I don't know. But the 80% of dentists in 2005 were white, that is non-Hispanic white. And then in 2020, 70% of dentists were non-Hispanic white. And at the flip side, as the percentage of white dentists decreases, the percentage of non-white dentists increases. And so we see the percentage of Asian dentists increasing quite a bit from 2005 to 2020. We see the percentage of Hispanic dentists increasing and the percentage of Black dentists staying about the same, which is interesting. And then the percentage of other dentists, which I think is largely, again, people who are 2 or more races, also increasing. So if you recall the percentages of the US as a whole, you note that the diversity of dentists in the US doesn't perfectly mirror the diversity of the US population as a whole. Non-Hispanic white dentists are going down as a population of dentists, but they're still overrepresented among dentists as opposed to the US population as a whole. Asian dentists are also there are more Asian people who are dentists as a proportion of dentists than there are Asian people in the US as a percentage of total people in the US. And so often when we're talking about race and ethnicity and with dentistry and if we're breaking it down, it's to increase the percentages of what the American Dental Association's Health Policy Institute defines as a significantly underrepresented population. In this case, Black and Hispanic dentists, which you can see the dentist bars on the left there are a lot lower than their percentages in the total population. So conversations around this tend to be, you know, how can we increase the percentage of underrepresented dentists? So that is 2 of the 3 changing demographics here. The last one that's also really interesting is age. And so the age distribution of dentists is slowly shifting younger. So in 2010, the average age of a dentist was 49.4 years old for the average US dentist. By 2020, the dentist got a heck of a lot younger and was 49.3 years old on average. Obviously, that does not look super dramatic, but there are underlying trends behind that shift that are worth noting and that are going to make a bigger difference when we come to talking about what these mean for changing practice. So the first is that the percentage of dentists here in the US who are at the age of 65 or older, which we tend to classify as retirement age if they want to retire, is in fact growing. So in 2010, 11% of dentists were the age 65 or older. By 2020, it was 16%. And so it's interesting to think, right, the age of the average dentist is getting younger, even though there are more experienced dentists who are continuing to practice. So that means something else must be going on at the other end of the spectrum. And we kind of see, if you break that down for more experienced dentists who are age 55 and older, that the proportion of dentists in this age group hit a peak of 40% in 2013 to 2016, and it's been declining ever since. I think this is because the baby boomers are now probably, for the most part, in that 65 and older group, and that is the largest US demographic. And so these were people born in like the post-war era, and they're a really big demographic, but they're kind of slowly aging out of it. So even if a greater proportion of people 65 and older are still in practice, the generation after them is smaller. They have fewer people. And so we see the percentage kind of going down. And so it decreased to 37% in 2020. And the American Dental Association Health Policy Institute further projects that it's going to decrease to 33% in 2040. And again, this is a part of the story, but it's still not the biggest part. The biggest part is what's going on at the other end of the spectrum. And that is the percentage of dentists under the age of 35. And this is growing quite a bit. So dentists under the age of 35, the percentage was just 15% in 2010, and it was 17% in 2020. And there's really one big reason for that, and that is the new dental schools. So this is a quote from Marko Vujicic. He is the chief economist and vice president of the American Dental Association Health Policy Institute. And he said, this finding originates from the opening of 10 new dental schools in recent years, expanded enrollment in established dental schools, and the resulting additional graduates entering the workforce. And so I heard earlier New Zealand only has one dental school. We have quite a bit more than that. So maybe we can send some of the graduates your way if we ever need to balance anything out. But you can see as of 2020, there were 67 dental schools in the US. This is a record high for us. The last peak was 60 dental schools in 1980. And that corresponds with, like I was talking about, the baby boomers, the biggest demographic at that time. Millennials are the second biggest. And so those are people between the ages that I think of roughly like 30 and 50 right now. And so you can kind of see the demographic trends in the dental schools, right? Like it gets bigger as the baby boomers are going to dental school, and then it shrinks a bit. And then when millennials come to dental school, there are more again. And also more people are going to college and etc. So we're getting more people in dental school, which means more young dentists. And so I think it's really interesting, like we're at a peak for dental school and we're going to have so many more dentists. And so these stats are all, oh, it went backwards. Why is it going backwards? Okay, there we go. These stats are all very interesting, right? That we're getting more female dentists, more non-white dentists, and a younger dentist age because we're having more dental school graduates. But really it comes down to like, why do they matter? Like, why have I been talking to you about these and giving you backgrounds? And it really comes down to they matter because people from different backgrounds, from different age groups who identify as different things, want different things out of their dental practice. What Robert, the average older white male dentist, might want out of his career could be very different than what a young Latina might want from her practice. And so as the demographics of dentists shift, so too does dental practice. And here's where I think things start getting interesting, because we're going to actually start seeing the changes, and we already are. So there's a few ways that dental practice models are shifting here. The first is practice ownership. The second is solo versus group practice. The third is corporate dentistry. And the fourth is, again, it's something that I feel like gets left out, but I think is important, is care for underserved populations. So practice ownership. At least here in the US, I imagine it's probably similar in New Zealand. Dentistry kind of came out of, it actually came out of, I think, barber shops, which is why I have a barbershop picture here. And that mom and pop style dental practice has been the norm in dentistry for like literally more than a century. And, you know, it's worked well. You could say it has been what it's been, but we're seeing signs that is starting to change because the number of dentists who are owning their own practice has been declining and continues to decline. And so we have the percentage of US dentists who own a practice. In 2005, it was 85%. In 2021, it was 73%. Again, this is a pretty big difference. It may not seem super drastic, but I think it's important to note that we know that there's gender differences when it comes to practice ownership. So historically and currently, female dentists are a lot less likely to own a practice than male dentists. And so if we use our analytical minds and we know that the percentage of female dentists is growing, and that female dentists are less likely to own a practice than male dentists, then we'd expect to see fewer overall practice owners, and that's exactly what's happening. And so if you actually like break it down, you can see female dentists who own a practice, it was 68% in 2005 versus 60% in 2020. And then importantly though, I don't think that this reflected because the male should be 80%. So it's the slide is wrong, but practice ownership is declining for men too. And we're going to see as I go through the slides, practice ownership is declining by gender, by age, by pretty much everything. So it's not just that we're having more female dentists, it's also as a whole, dentists are apparently less likely to want to own a practice for a number of reasons. Age is another big one. So this is, I think, a more dramatic drop. In 2005, 80% of practice owners were under the age of 35. In 2021, only 44%, less than half of dentists were practice owners. And so this is probably one of the most drastic drops that I've seen, especially as I was putting together these slides. And I think the one that's going to have the biggest change on the future of dentistry here in the US is just the difference in some ways of like the demographics of the way that young dentists are practicing is so different than previous generations of dentists. And so you can see practice ownership is declining across, like I said, all sorts of people. This is by age groups. I'm going to close this door because it sounds like someone out here is doing yard work. Okay, hopefully that's a little quieter now. So yeah, you can see that the change in practice ownership is across all age groups that the American Dental Association Health Policy Institute studies. However, it is a lot more drastic for young people. 12% decline in practice ownership for people 35 to 44, 45% decline for people under the age of 35. And very much related to this is the next trend, and that is group practice. And that is by group practice, I mean the decline of solo practice and the rise of practices with multiple dentists under one roof. Which kind of makes sense, right? Because like if you're not owning your mom and pop style dental office, like you're still practicing dentistry, so where are you going to be? Probably working with another dentist. And so we see very similar trends as for practice ownership. So the percent of dentists in solo private practice is now under half. And related to that, there are trends, intersections between demographics and the chances of being in a solo private practice. For instance, female dentists, less likely to be in solo practice than male dentists. And so for male dentists, just over half were still in solo private practice in 2021. For female dentists, it's closer to like 1 in 3 female dentists were in solo private practice in 2021. And also, just like our ownership trends, there's also a correlation between solo practice and age. And so if we look at dentists who are in solo practice who are age 30 to 34, it's like 1 in 5 in 2021. It is no longer near the norm for young dentists who are like right out of school. Even in 2010, you can see it was closer to like 1 in 3, 31%. And there's just been this continued decline of young people who aren't working by themselves, who aren't owning practices. And that kind of is the perfect segue to our next trend here, which is, oh, I have it also by age. So you can see the change in solo practice is very much, again, like the private practice slide, looking very similar here, except it's a little bit stronger for the young groups, where we can see a lot fewer dentists across age groups, across all different margins are in solo practice, but that is drastically more for people who are younger, especially like if you look around that 35 to 44 bar, all the way down to under 30. It's just incredible how quickly this paradigm that's been around for a century, if not longer, is changing. And so, yeah, if dentists aren't owning their own practice and they're working with other dentists, where are they working? And that tends to be corporate dentistry. Also, bigger dental group practices. So it doesn't have to be corporate. It could just be, you know, one dentist owns a practice that 4, 5 other dentists work in. Whereas before, each of those 5 dentists were probably a lot more likely to have their own practice. It's a lot more resource sharing. But yeah, one way to do that in dentistry that is growing significantly is corporate dentistry here in the US. When I speak of like corporate dentistry, I'm often talking about big private equity owned chains. They're typically called dental service organizations or dental support organizations. Sometimes they're called dental practice organizations. I'll reference them simply as DSOs. And yeah, they are growing here in the US. So we in May just updated our annual list of the top 10 DSOs, and every year they keep growing. The US shut down dental practices for the pandemic for like a month or so in 2020, and they kept buying practices and kept growing. Like, it is astounding. There must be some kind of what they're doing must be resonating with especially young dentists, which we'll get to, because yeah, they're growing. They all have different practice models. Typically, DSOs will outsource some of the business side of dentistry. So think billing, insurance, hiring, technology, etc. And in exchange for some kind of ownership, partial ownership, a percentage of ownership. Some dentists are just employees. Some are owner dentists with a DSO where they have some control, but they don't fully own their practice outright. And so the top 3 are Heartland with over 1,500 practices, Aspen Dental / Tag the Aspen Group with more than 1,000 practices, and Pacific Dental Services with 850 plus practices as of when we did our article in May. So again, these are like a lot of dental offices working even just for these top 3, and those are the top 10 brands according to our list. And so there's not a lot of great long-term data on the corporate side of dentistry because it is kind of relatively new and not something that we've been studying for a long time. The Health Policy Institute said about 10% of dentists in the US were affiliated with the DSO in 2019. I can almost guarantee that's higher now because Marko Vujicic in webinars has said that, you know, the pandemic, it was a metaphor essentially like the pandemic, if these trends in dentistry were a fire, the pandemic was like gasoline and just accelerated all of these trends. And I can guarantee with the uncertainty of practice closures, with who knows like what was going to happen, like if we think back to 2020, that young dentists are like, well, but DSO probably is going to feel more secure, I would imagine. And dentists that are retiring or may have been struggling and were debating selling to a DSO might have been like, you know what, now is a great time to pull that trigger and go join a DSO and have maybe what feels like security in an unsecure time. And so I think we're going to see big growth in DSOs moving forward. So again, there are trend lines related to the demographics, also related to DSOs. It's almost like a theme of this presentation. And so you can see female dentists are more likely to be associated with the DSO than male dentists. But perhaps, again, the more meaningful difference here is generationally in younger dentists. So if you look at, again, more like that quote unquote millennial demographic of people in their 30s and 40s, they are a lot more likely to be opting into the DSO practice model as dentists who are in their 50s and 60s. And so, as you can see, like this is even before the pandemic, 1 in 5 dentists under the age of 35 was affiliated with the DSO, compared to just about 5% of dentists who were 50 and older. And that percentage is, I can guarantee is probably even higher now. So we don't have a ton of data yet, but it seems like it's going that way because the ADA did ask dental school seniors entering private practice whether they plan to join a DSO. And in 2015, it was 12%. And I'm pretty sure this is 2020 and not 2019, like the headline says. Yeah, okay, that's 2020. Because I was like, I'm pretty sure I pulled pandemic data. And so yes, but in the pandemic year of 2020, that was up to 30% of dental school seniors who plan to join a DSO. And so I just kind of wanted to take a quick pause here because if you're looking at this data, you may be thinking like, well, why? Like we're seeing some trends for, you know, female dentists, but like it seems far bigger of a deal generationally, right? It seems like young dentists have very different trends. And why is that? Like, why are they more likely to be part of DSOs? Why are they less likely to be practice owners? Why are they more likely to be in group settings? And it's a great question, and one that a lot of the like demographers in dentistry are asking. And I don't think we're 100% sure that we have an answer. The ADA Health Policy Institute is looking into insurance, which seems to be like insurance payouts from companies, which seems to be part of the answer. But we also know that, again, American millennials, when surveyed, tend to value freedom, which perhaps being a dental practice owner doesn't get you quite as much as being an employee. We know that American millennials are a lot worse off financially in almost all aspects than earlier generations. So maybe practice ownership is unappealing or outright unfeasible. And we also know American millennials have a lot of student debts, And so the average US dental graduate had $292,169 US dollars in 2019. I put that into Google and it said that was 453,193 New Zealand dollars, which is a lot of money. And on top of that, a study earlier this year found dental students, right, they're making thousands of dollars in payments for more than a decade. And my thinking is maybe that kind of debt can make it hard to like balance other things that young dentists might want, things like buying a car or buying a house, which also require debt. And then the cost of those, the car and the house, are also now like at record highs as well. But what's really interesting, right, is like the ADA Health Policy Institute actually looked into it and found debt only had a moderate effect on dental practice decisions. And so one 2017 study found a dentist was more likely to join a DSO as their student debt went up. So debt does have an effect, but it doesn't seem to be having quite as strong of an effect as like the trends. It can't be the only thing to explain the trends, because if it was debt alone, it wouldn't be quite the drastic drops in ownership and increases in DSO affiliation that we're seeing. So there's something else that's going on. And in a webinar, again, Marko Vucisic, chief economist for the Health Policy Institute, said it is in fact gender, age, race, and then also things like whether your parent was a dentist that are all having a much bigger effect on these trends than debt. So he has a lovely quote that I actually pulled over because I really liked it so much. And he says, quote, "In my view, there are fundamentally much stronger forces at work with the generational divide, with how young people want to live and work, who they're marrying, whether they want to be tied to a certain city or be mobile, whether they want to go brew beer at night or do their artwork or their side hustle versus doing their payroll on Saturdays. There are so many massive generational shifts that are driving this. So it's a mistake to think that easing the debt burden will erase these trends." And I think you just said that so well, of just, again, why talking about these demographics are so important, because there is this big shift happening in dentistry. And in the same way, I feel like when you look at that data that I've kind of walked us through for the past so many minutes, you can kind of see quite as we saw the number of female dentists increasing starting in the 80s, and we're starting to see that effect now on practice. I think these other trends and the rising DSOs, particularly among young people, in 20 years, 30 years, we're going to really start seeing those effects in the same way we're seeing the female dentist effects now. So those are the three big things, right, that come up when we talk about shifting dental models here in the US. When I go to webinars, when I read stories, whatever, most of the time it's practice ownership, group practice, and corporate dentistry. But I think there's a missing component, which is care for underserved populations. And I think it's going to be a big effect of this massive generational shift that Marko Vucisic was talking about. And again, I think it gets overlooked. But I think in order to understand care for underserved, I kind of need to take a minute to talk about what I think is a bleak oral health situation here in the US. And so percent of adults who say their mouth and teeth are in good condition. Here in the US, it's 70%. 70% of adults say their mouth and teeth are in good condition. In New Zealand, it's higher. Good job, New Zealand. It's 80%. Those are relatively close. I think we both can be doing better. But I think what gets lost in the US one, and it could be true too for New Zealand, I don't know if you have quite the income disparities that we do here, but things are a lot worse in some ways for low income adults. So I think I have a slide on that. Let's see. Yes, okay. Percent of US adults with poor oral health. There is a huge disparity here between low income and high income adults. So about half of low income adults here in the US say their mouth and teeth are not in good condition, compared to just 15% of high income adults. That's a really big difference. And so low income adults, they also say, let's see, I pulled some data. 42% say they have difficulty biting and chewing, which are pretty essential and something that dentistry is well poised to address. 39% say life is less satisfying because of the condition of their teeth and gums. 37%, that's more than 1 in 3 low-income people here in the US, avoid smiling because of their teeth and gums. Let's see, quite a few say, yeah, 29% say that their teeth and gums affect their ability to interview for a job, which would make it easier for them to make income and then not be in the low income category anymore. It's truly astounding how few people who who fall in the low income category can access oral health care here. It's more stark for low income people. You also have similar trends for young people in the United States. Again, let's see, it's what 35% of young adults say they have difficulty biting and chewing. And if you're a young adult, which I think the defined is under the age of 30, hopefully you don't have trouble biting and chewing. And the fact that 1 in 3 do is concerning. And so I think, it's really interesting to see these trends and kind of pause and think about why. And chances are maybe they're not going to the dentist, and we kind of know that. So the statistics do reflect low dental visits among adults in the US. And so only 37% of adults in the US had a dental visit, which was quite a bit lower than New Zealand. You only had half, but like half is still better than 37%. We both have work to do here. And again, in the US, kind of like with the state of oral health, we see a huge disparity here with income. And so half of high income adults here in the US go to the dentist, and that is on par with New Zealand, but only 1 in 5 low income adults go to the dentist. And there are a lot of factors that go into this. Like we know transportation is a barrier, getting time off from work is a barrier. But we also know the #1 reason why people here don't visit the dentist at least once a year. And we know that reason is cost. So the American Dental Association and a bunch of other surveys have consistently asked people why they don't visit the dentist more frequently. And it's always cost, cost, cost. And so 59% of people say cost is the #1 reason they don't visit the dentist more often. Cost comes up as the top reason for people of all income brackets, all ages, all types of dental insurance. But it's reasonable to say, right? Like if you have less income to work with, cost is going to be an even bigger barrier to getting to the dentist. And so one way to help reduce cost barriers is insurance. And we have good data now for children that expanding public insurance has improved the amount of kids actually going to see the dentist. And so the US healthcare system is complex, to say the least. Back under President Obama, we passed the American Care Act. It's often known as Obamacare. Probably heard about it. And basically what that did is created like 10 essential health benefits. And what we did is we included dental care as one of those 10 essential health benefits for children, but we did not do that for adults. And so now we can see like, right, we've had enough data. We're now 2 presidents out from Obama. We've had enough time to see like, expanding the public and private insurance, dental insurance for children has made a meaningful difference. And nothing has like necessarily changed for adults. And so it is very complex for adults. 51% have private dental insurance, 20% have Medicaid, which is a state-by-state public insurance program specifically for low-income people. The US is big, and Medicaid programs vary quite a bit because there is no federal requirement to provide dental coverage for people. And so some states, like California, I'm pretty sure, has full comprehensive Medicaid dental benefits for low-income adults in their states. Some states have absolutely no dental benefits for low-income adults in their states. Some have emergency only. It really varies. So that's Medicaid. And then another 23% have no dental insurance because not every employer here offers dental insurance. And you would have to buy it on your own, but maybe you can't afford it but you don't qualify as low income. And it is a whole mess. And that is a little bit of the state of US dental insurance. So why does this all matter for a talk about dentists and dental practice and shifting demographics? And the reason I bring any of this up is because we know women dentists, young dentists, and non-white dentists are all more likely to participate in Medicaid and the Children's Health Insurance Program, which is another public dental insurance program, which are programs specifically aimed at providing healthcare, oral healthcare, for low-income people who we know are the most in need of oral healthcare and have some of the worst oral healthcare in the US. So taking it back one last time through those demographics I talked about earlier, the percent of US dentists who participated in Medicaid or CHIP in 2019, 49%, almost half of female dentists participated versus 41% of male dentists. If you look based on age and race and ethnicity, it is astounding. 39% of white dentists participated in Medicaid or CHIP in 2019 versus half of Asian dentists and Hispanic dentists and almost 2 out of 3 Black dentists. Again, it's astounding when you think about it. If we increase the diversity of dentists, the chances of them participating in programs that are helping low-income people, the chances seem to be higher. And then lastly, related to that is age. Young dentists are far more likely to participate in Medicaid and CHIP than older dentists. So people 65 and older, 1 in 3, versus more than 1 in 2 dentists under the age of 35. Now, how much these trends continue as people get older, who knows? But I kind of, after seeing this data, my hope is that as dentistry gets younger, gets more female, gets more diverse, it also means that here in the US, we're going to do a better job of caring for all Americans, and that hopefully our oral health outcomes will start to look a little bit more like yours in New Zealand. So that is about it. I hope you enjoyed the presentation and have a better understanding of how dentistry and the change in diversity is going to affect dental practice moving forward. So
thank you so much, Theresa. Actually, I just have a few notes there. It was very interesting because I think it's gonna, I mean, I would like to see other how do you say, countries, and then you kind of to see what's the trends happening, because I can definitely, we go to, so there's one university here, Otago University, it has dentistry, can only go 80. So to get there, it is super hard. You do, I think, the first year you do like a general science degree for 1 year, and then you get into dental school, and it's super competitive, big time. And there's a lot of people that they just can't get, and then ended up going overseas to study and eventually come back. But we go because we sell loops, so we sell loops. So we go maybe 3 or 4 times a year to sell loops to the students, and you can tell, I would say, over 70% they're women. In really? More than half, in more than half, it will be white women. So, I mean, New Zealand is a very multicultural and diverse country, and so it's, I can tell that, I can see that it's, I will say common, but I will count with one hand a white man in dental school. So
that is interesting.
Yeah.
So it's global. It's not just here.
Yeah, exactly. So I was waiting to see other countries, and then also, we have a lot of, as I said to you, we're desperate for dentists, so we get a lot of people who just, I was explaining to Theresa that if you are from English-speaking country, pretty much you can move here. I mean, you still need a work visa, but you can get that through an employer. And then you get a job. And big corporates here, they do that quite easily because big corporate, they advertise for 2 or 3 months. They can get a dentist, a sponsor, they come here. But they do. If you are from a different country, like let's say we have a significant amount of dentists from India or from Iraq, or other countries, that you do a registration exam. So you kind of do, theoretical exam and practical exam, and then they do go through these, which it costs a lot of money as well. And they register, and they open the the practices as well. So it's a lot of that happening from different countries as well, not necessarily only from the States, Canada, or the UK, which was the most common ones. You'll find some, Germans and other countries as well. So that's very multi-corporate. And then we have, I'm just gonna see, because I saw the corporates that you post there, and we should also remember that in the States, there's like small corporates, within, because, I have a friend who's a dentist in Phoenix, and he works for a small corporate that is in Phoenix only, right? Like they own like maybe, I don't know, 10, and that's like a mini.
There's a lot of this.
Yeah, and there's like, it's just so common. And here in New Zealand, it's, you have a big corporate. Actually, there were two big corporates and one bought the other big corporate. So
wow.
they become the super big corporate, right? Which is funny enough, it is in New Zealand. Well, it was in New Zealand now, and it's a public company now, and I think some like Canadians, but it was started in New Zealand and it become huge, in Australia as well. And they're kind of the biggest corporate, but you have other ones that are like maybe 5 owners and they own like 20 practices and stuff like that. So it's happening, and it's happening more and more. We have also there is an Australian company that is also here in New Zealand that you can join. It's like a membership. So if you're a solo practice, you join this and they have like a special discount for different suppliers, and you kind of become a small corporate, you own. So that's also happening on the trends here. And I think there's no more expensive universities in the world than the US. And I'm sorry to tell you that, but you can study anywhere cheaper than that. However, they're good education, right? But not necessarily. You can still pay a lot of money in the US for not the best education.
It is very true. You can spend a lot of money on a not great education.
Yeah. So here in New Zealand, all schools are free, until you finish, high school. In New Zealand, they call it college, but it's actually high school. Like that's you and I will call it. And then university, the first year is for free. And then the rest year, you can get a student loan interest free. So then automatically you pay back. The IRD, which is like the fiscal, it takes the money. Once you start making money out of a certain amount, I think they start taking, if you want to pay more, you can pay more, right? But this interest free, until you pay it off. So it's a pretty good incentive for people who study. But I would say that, becoming a doctor or dentist is probably the most expensive one. And it will be around maybe $150,000 Kiwis. So which will be around $100,000 debt that you ended up finished with, which it makes a huge
difference. Much cheaper.
Yeah, exactly. So it is. And also we have a lot of people from overseas who come and study here to become a dentist, people from like Singapore or Malaysia, that when they finish, they go back to the country. So we ended up with really little, pool of dentists here. And so not joking, but if you know anybody who's willing to, you can get a job here super quick. Anyway, however, the disadvantage, because we're such a small community of dentists, everything is so expensive. You wouldn't believe how much the toothbrush or a composite here to buy. So that's the other disadvantage.
Trade-offs. There are trade-offs.
Yeah, we have free dentistry until you're 18. So any basics, dentistry until you're 18, and after that, you have to pay. The difference is in the States, you have the insurance for your dentist. Here, this like they will cover, some insurance will cover the day-to-day dentist, and the hygiene clean and stuff. However, if you need an implant, if you need all of that, that's not going to happen, right? That's gonna come from your pocket. But
I don't think dental insurances here cover implants either. Even private ones, they may cover a little bit, but overall, dental insurance in the US is really interesting, where they've done studies. Again, wonderful. ADA Health Policy Institute, they look at everything. They did a study and they actually added up what you spend on your premiums, and I think it was like a wash. Like you didn't get enough benefits back to make it worth the cost of what you're paying into it. And
Yeah.
that's what they're looking at for like particularly what's driving corporate here, and young dentists especially to go into corporate dentistry. And it's like insurance reimbursements from those insurance companies that aren't working very well from patients,
Yeah.
also aren't working very well for dentists right now. And
Mhm.
so that is, I think, going to be something we're going to be talking a lot more about. So that's really interesting to hear, though, how
Yeah.
it works in New Zealand.
Yeah, but definitely the trend is women here, dentists, and you can see. I just visited one client who she opened the second, her second shop. And she will be, I would say, a young woman around my age. So I don't know, probably even younger actually. So the other trends happening here and started a few years back is special aesthetics. Dentists doing derma fillers and Botox as well. Which I'm not sure if that's a trend in the States, but yeah, that's pretty cool. I really enjoyed to see. I'm really into aesthetic. I love to hear like there's the percentage of this and the percentage of that. So I really enjoy that. Yeah, thank you so much, Theresa. So just before I let you go, what's the name of the podcast again?
It's called Mission Driven Business.
Mission
You'll
Driven.
find it on Apple Podcasts, Spotify.
Mission Driven. I'll listen to it. Yeah, but anyway, thank you so much, Theresa. I hope one day you make across the Pacific and visit our little islands.
I know. I need to get out there. It's been on my bucket list actually to go to Australia and New Zealand.
It's
I
only
haven't
an
made it
overnight.
yet.
It's only an overnight flight, so pretty straightforward from LAX. Bam, you're here. You wake up in the morning here, so it's pretty straightforward. So, and if you do, just let us know. We'll look for you here.
All right, good to know. I've made a friend now. I have a friend in New Zealand.
Okay, cool. Well, nice to meet you. And thank you everybody for joining us. And I will see you again in our next Dental Chat.